IBS is probably the most prevalent gastrointestinal condition. It accounts for about 10% of the population worldwide, and in the US, 10 to 15% of the population. So imagine a patient who wakes up in the morning and doesn't know when they're going to have a bowel movement, if it's going to be diarrhea or constipation. Are they going to be at a restaurant with friends? Are they going to be in a meeting? I mean, it's very traumatic because it's unpredictable in terms of the function. So there have been a lot of false roads to the discovery of IBS. Part of the reason is IBS was thought of as a psychological disease. That kind of leads patients on a bit of a goose chase because they have to go from doctor to doctor to try and get some answers. IBS, there's no definitive test, so they go to another doctor. Again, the tests get repeated. So often these patients go a number of years before they get a final diagnosis that they're confident with. The development of IBS check has been probably 8 years in the making. We discovered this toxin a number of years ago and thought that it might be relevant because all food poisoning had this one toxin. So eventually we discovered that this was the toxin that could be the cause of IBS. You know, after seeing thousands and thousands of patients who suffer, who've seen many physicians, who want to arrive at an answer, this could be the answer. It gives them a diagnosis. For the 40 million Americans who have irritable bowel syndrome, they now have a test that says, you have IBS, it's real, it's an organic disease, it's not a psychological disorder, and they can go straight to therapy or at least get an answer.
Is triggered by a common tummy upset. Food poisoning, says Dr. Mark Pimentel, director of the GI Motility Program at Cedars-Sinai Medical Center in Los Angeles. LifeScript.com's Mari Cartel has more.
When Ellen Corney began having bad cramps and diarrhea, she knew something was terribly wrong. But it wasn't until she went searching for a diagnosis online that the interior designer discovered it was irritable bowel syndrome. The symptoms were unmistakable.
It's not life-threatening, but there are moments when you just feel like you just want to...
Corney found help from Dr. Pimentel, but not before hitting the bottom, so to speak.
Well, I think driving to Las Vegas in a diaper was one of the lowest points I ever had in my life.
Corney learned by trial and error which foods caused a gut reaction.
You can't have sugars, no desserts, breads are no good. I mean, the list is endless.
Dr. Pimentel agrees that there are foods like sugar that intensify symptoms, but he explains that IBS is caused by an overgrowth of bacteria in your stomach, which is a direct result of food poisoning.
When the gut nerves are damaged because of the food poisoning, the gut doesn't flow correctly. It's like a river that's not flowing well. If it's not flowing well, it becomes stagnant and bacteria build up. So we try to identify that the bacteria have built up, and then we treat the bacteria with an antibiotic.
Until recently, however, many medical professionals firmly believed IBS was a psychological problem.
We came along and we were not focused on the abdominal pain, which a lot of others were focused on. We focused on bloating. And we know that bacteria of the gut can produce gas, and maybe that's where the bloating was coming from.
All it takes to diagnose IBS is a simple breath test.
We give you a sugar to trigger fermentation in the gut, and we're able to see on the breath how bad things are.
Now Dr. Pimentel is treating IBS with antibiotics and getting great results with patients like Ellen Corney.
They usually respond within 10 days of the antibiotic, and it doesn't matter how long they've had it. Patients come to my office, they've had IBS for 20 years, and then 10 days later they respond just as well as a person who's had it for 2 years.
And even though she's still recovering, Corney can now joke about her IBS journey.
There I was in Las Vegas in adult diapers, and the biggest crapshoot was not in the casinos. It was whether I could last the night.
From Cedars-Sinai Medical Center, I'm Mari Cartel.